Yeah.
Okay, we will start with first communication scenario is ICD insertion. So Mr. Sami, 50 years old, a known case of ischemic heart disease, admitted with chest pain, palpitation, short suppress, ECG done showing VTAC and antiarrhythmic medication given to him, and cardiology consultant asked for recommend ICD. So you are senior officer. You have been asked to explain Mr. Sami's condition and answer questions. So today we'll discuss this issue with Dr. Izad. So Dr. Izad can start. You have 10 minutes. Start.
Yes, sure. Hello, I'm Dr. Azad, one of the senior house officer here working here.
Yes,
Are you
doctor.
Mr. Sunny?
Yes, doctor.
50 years old.
Okay.
Okay.
Yes, doctor.
Nice meeting you, sir.
Nice
I'm
to
here
meet you,
to
doctor.
talk with you regarding one of your health issue.
Okay, okay,
Is that
doctor.
all right?
Yes, doctor. Yes.
Thank you. Before starting, would you mind if I ask you what's going on with you?
No, doctor. I'm okay, doctor. I'm all in today. Thank you.
Okay. Because today's agenda is talking about regarding one of your health issue.
Yes.
Before coming to the point, would you mind if I ask you how far do you know regarding your condition?
Yes, doctor. Really, doctor, my condition started about 3 days ago. Suddenly, doctor, I had chest pain and uncomfortable breathing, and also, doctor, racing of my heartbeat and short of breath. So I was admitted in your hospital, doctor, and one of your doctor informed me I had abnormality in electricity of my heart. So he gave me some medication, doctor, and my condition now is stable. But he informed me the more issue we'll discuss with you today, doctor.
Okay, right. So actually, I am here to let you know regarding our planning of your heart, abnormal heartbeat. As you are absolutely right, you have some issues of your abnormal heartbeat in your heart, as
Yes.
you know that. And do you know your diagnosis? Anybody told you?
No, not the name, but the doctor informed me only is abnormal electricity of my heart, doctor.
Yes, of course. So my consultant told me to talk to you regarding our management plan, and
Yes.
that is we want the best management
Yes.
plan to control your abnormal heartbeat, which may be sometimes very life-threatening, which may be sometimes becoming very dangerous for you, you know. So what we are going to do now, and at this moment, you are on the medication, right? You are on the medication to control the rhythm or to control the heartbeat.
Yes.
But the thing is that the abnormal heartbeat, which we diagnose, we use a medical term for that. That is ventricular tachycardia. You know, this is a medical term for a medical condition, which occur for the people who have abnormal discharge from their heart. Yeah, I want to show you a picture. I want to draw a picture from for you if you want to know about your heart condition.
Yes, doctor.
Here is the heart, and there is some special tissue inside the heart from where the conduction started to begin. Okay, and this discharge is spread to the whole heart to maintain the normal function of the heart, that is pumping of the whole heart together.
Yes.
And what in your case would happen, this discharge become abnormal and becomes so rapid that heart cannot contract together. Okay.
Yes.
Cannot contract. We called it synchronization, or we called it good pumping activity of the heart is obstructed because of this abnormal discharge. So what we have to do, we have to regain this normal discharge again, right?
Okay.
To cure your problem. So in this field, the most important thing is to plan a good treatment, and so far the best treatment is to provide a device in you to help your heart. Are you with me, Mr. Swami?
Yes, doctor. I follow you, doctor. Yes.
Thank you. So we are planning to give a device which will help to control the abnormal discharge from your heart and to help to pump the blood synchronously to your whole of your body.
Yes.
Are you getting me, Mr. Sami?
Yes, I follow you.
Okay, and this device is known as ICD in short, which means implantable cardioverter defibrillator. In the short term, we called it ICD.
Yes.
Okay, so have you ever heard this?
No, really, doctor. First time to hear about it.
Yes, this is actually a device which will, as I told you, which will help your heart to control the abnormal discharge and to prevent the life-threatening condition, as
Yes.
well as help the heart to pump the blood. Do you
Yeah.
want to know more about this
Yes, doctor.
device?
Please, doctor, inform me about everything about this procedure, doctor.
Okay, thank you. So, the before procedure, with all aseptic precaution, we take your consent, and we'll admit you. It is for indoor basis, but not more than 48 hours. You have
Yes.
to stay. If there is no complication, then you can go home earlier.
It's okay.
And and this device is put on by specialist doctor only
Yes.
who did this 100 times before, and they're very trained trained cardiologists, trained heart doctor
Yes.
who can put this device
Mm.
on your chest, and one of the wire will go to the heart, as I am showing you on the drawing. I am drawing you
Yes.
the device will be on the chest in the as a pocket, and the wire will reach to the heart through some blood channel. Okay.
Yes. Yes.
During the procedure, before the procedure, we'll take all the precaution, and during the procedure, we'll do that with all aseptic precaution as well as with expert doctor.
Mm.
And after the procedure, after the procedure, it takes only 1.5 hours max, not
Yes.
more than that.
Mm.
And after the procedure, you will be in observation for 24 hours.
Yes.
And after that, if there is no complication arise or everything goes fine, then we can give you discharge to go home.
Yes.
But as ICD is a device, so and this is a procedure, it may have some complication during the procedure. Do you want to know about this?
Yes, doctor,
Okay.
please. Yes.
Every procedure has demerits, have risk. It's its own risk. There is some risk of infection, as because the device is put on in your chest. Also, there is a chance of bleeding, and sometimes it may change its position. May need another procedure to reposition it. And the thing is that as this device is discharging itself, so you maybe take care of the time when you put on this device, it will be at your chest all the time. So you should be aware of something. So we'll give leaflets,
Yes.
though you can go through details regarding this ICD. But
Yes.
I can tell you that you have to aware, or you can't place your mobile phone within 3 centimeters of this device, and you have to away from electrical shock giving any tools or body pain removing tools, something like that. No worries, we will give a leaflet and brochure so
Yes.
that you can go through each and everything, and you can come with it in. Is that
Okay.
all right?
Yes, doctor. I am fully with doctor. I have one question, doctor. Is
Sure.
only the
Yes.
drug is enough, doctor, to my condition?
Yeah. Yes. Again, please pardon.
Is only the drugs is enough to my condition? Why do doing this procedure? I think it's very enough to take only medication, doctor.
Yeah, I understand that. I appreciate your concern, but the medication will not prevent repeated attack of this dangerous discharge that can be controlled by this device very efficiently. That will
Yes.
be a life saving for you.
So this my condition, doctor, is a serious doctor condition.
Yes, of course. I am afraid it is something serious, but we can prevent it. We can control it. If you control, we can. If you take a good treatment, it will be not so. It will be not life threatening,
Okay,
and
doctor.
yeah, you will be out of danger if we can give you ICD,
Yes.
and you can maintain you can be in our follow-up, regular follow-up.
Yes.
So we can take over it, and it is a device. Actually, you have also recorder inside.
Yes.
So if there is abnormal discharge, they can acknowledge it and they can prevent it. That's
Two,
why
mi
your life will be
2 minutes remaining. It's okay,
your
doctor.
life.
2
Yes.
minutes remaining. So, doctor,
Okay.
I am bus driver, doctor. Is
Yes.
this procedure will affect my job, doctor, please?
Yes, I understand. I appreciate your concern. Basically, if you have no symptoms and you are in follow-up, your device is working very well. In that case, it will not create any problem for your job,
Mm.
hopefully. But till then, we'll inform GVLA,
Yes.
and also they will take over it. And if you need any job adjustment, I will also involve occupational therapist. I think they will take care of it, and you will be compensated for any loss or any readjustment.
Okay, doctor.
Is that all right?
Okay, doctor. It's okay. Thank you, doctor. Another thing, doctor. Every week, doctor. Last week, in weekend, I play football with my friend, doctor. Is
Mm-hmm.
any precautions for this, doctor, please?
As it is, yes, as you are on the middle of your treatment plan, right? So till we have the ICD implant, and so I would like to request you not to go for any strenuous exercise or
Mm.
any playing, any such playing like football or anything. You need to keep rest. Okay, you can call your friends to your home and can play chess or
Okay.
something like that. How sounds it to you?
Okay, doctor. Last question, doctor. Is any specific precautions for this procedure, doctor, after the procedures?
After the procedures, pardon?
Any
Uh,
precautions?
Yes, yes. I will give you the leaflets to give you after the procedure. You have to maintain maintain the personal hygiene to prevent this
Yes.
infection, as
Yes.
well as you will have to keep your mobile phone and any
Yes.
electrical device out of this ICD.
Yes.
All of the things I will write it down, and all leaflets. I will give you some leaflets
It's
with all
okay.
the details,
Okay.
also brochure,
Yes.
and also I would like to give you some website address. You will get you can read, and at this moment you may have so many questions in your mind. Please
Okay.
feel free to call me with
Okay.
all the details after
S-
going through all
Okay,
details.
doctor. Okay, doctor. So, doctor,
Do you
I
have
will.
any other concern?
No, doctor. Thank you. I will take time to think about this procedure, and I will inform you soon, doctor.
Yeah.
Thank you very much. Thank you.
Yes. Thank you.
تمام. Excellent, دكتور إيزاد. Good. Yeah, are the make
Okay.
definition
But I
good.
missed about the
Uh,
consent, I guess.
No, consent you told
Yeah. Yeah.
before the procedure
Okay.
very important. You cover the consent. You good
Okay.
before
Okay.
good presentation first, and you give him presentation about the disease and good summary of about this disease and the plan of consultant, and you
Okay.
explain the procedures before and during and after, and the concern I think it's okay. Excellent, دكتورة إيزاد. طيب. Okay, so now we have difficult. I think it's difficult scenario because not common but came before. I think when you see first time in the exam, I think is maybe difficult to you. So it's better to know it before the exam. So try to we can draw some so summary about this scenario before you enter the exam. Ah, I am sorry. I think this problem will start again. Before your before the enter your station, as I told you, you have white paper. You can ask if you don't give you a white paper. You can ask about white paper before enter the station. If you have white paper, you can put the important point, as I told you, important point before the entrance station. As I told you, first one, you can write the name of the patient, and name of yourself. Also, what's your job in the is you are senior officer or on call today? Well, what's your job? And try to put the main issue or main agenda of the meeting today. So here are the VTech, ventricular tachycardia, and the ICD, as if this is your job. So in summary, you can طبعا good presentation. Good morning. I am Dr. Mohammed. Today we'll discuss your issue. Try to first to know how much the patient know about himself, so you can inform him. We're here today to discuss your condition. Please, how to inform how to know about your condition. So, doctor, I admitted here with chest pain, short suppressive palpitation. So you give medication. I'm okay. So the cardiology or heart doctor inform me. We'll discuss more issue about my condition. Yes, doctor, your condition have abnormal. So give a small definition about the VTAC and maybe abnormality in the rhythm of the heart. And the doctor is that doing very well. So it told the patient you have something has a heart and have something controls the electricity of the heart. Sometimes this electricity is more than we heart need. So when the rhythm increases, this affects the pump of the heart, and it's very, I think, I'm sorry to inform you, is serious condition if not treated. So our management or the plan of management is give you medication, and I think I'm happy to know you are okay now. But the cardiology consultant is asked for something called ICD. Are you hear about the ICD? No, doctor, it's first time ICD. So the one of the concern of the one patient ask you is the medication is enough? It's very important not give any your opinion to the patient except what present in the paper. يعني if you write paper, the consultant wants something, you يعني try to convince the patient about what consultant said, not give oh yes it's enough to take medication. It's very wrong. Try to follow the what consultant write in the scenario. It's very important. So about ICD is very important. Any procedures very important. We the schema you are put yourself before enter the exam. Very important. Any procedures you have to write before the procedures and during the procedures and after the procedure. Very, very important. Any procedure. If you don't know what the procedure will give any information to the patient, but try to put this schema to yourself before the scenario, before the procedures, and during and after. It's okay. So before we will admit you in the hospital, and this procedure done by expert doctor. We're doing is many times under a complete aseptic condition. We will doing this procedure, and before the procedure, we have very important to write consent. Very, very important about the consent. Very, very important consent. Very important point to cover this consent. So during the procedures, to explain any procedures, as we will inform you now, what's the importance, what's the advantage of the procedures, and what's the importance of these procedures. And after the procedures, I will admit him, or can go home and can drive, or can drive. And very important, the complication, what the procedures would happen, maybe infection, maybe trauma, maybe bleeding. You would inform him everything. And in the last thing, we'll inform him if he has precautions. As Dr. As I told, is very important to avoid the phones and electricity. We'll inform more information about it. To try to read the scenario with what I wrote, and try to read more about the information. So when you doing the presentation with the VTAG, give small 1 minute only. Give him what about VTAG, but more information mainly with what ICD. Well, what ICD is a battery power device placed under the skin. A thin wire connect to ICD to your heart. It's very important. Very simple to write. Can you write? Can draw this to the patient? Is battery device. So we'll insert under the skin, and wires connect ICD to your heart. So leads are inserted via veins under local anesthesia. تمام. Yes, and used in conjugation with antiarrhythmic drug. It's very important because he told you I only want the antiarrhythmic drug. No, it was conjugation with antiarrhythmic drug. Battery life has been about 6 to 7 years. This small definition, what or overview about the what ICD. Another scenario is another step. So function. What's the importance of these procedures? If abnormal heart rhythm is detected, the device will deliver electric shock to restore normal heartbeat. So very important. Yani, if you feel any abnormality with this, automatically will give electric shock to restore abnormal heartbeat. So also record the abnormal rhythm, which it's helpful to once shock has been delivered. So is also will give normal heartbeat or will give electric shock, and also will record abnormal rhythm. Can find is follow-up. طيب, how is pacemaker fitted? As I told you before, the procedures is under local anesthesia, very important, and يعني I think is local only, not general. So what's mean local? Local is you are awake and under during the procedures. Which you placed under the skin, very important, غالبا in the left side of the chest. As we told, attached wire that guided through the blood vessels to the heart. Chest X-ray is very important to check the lead's position. And about operation about 1 hour, take about 1 hour. And after the procedures, it's able to leave the hospital at the same day or the day after surgery. So okay, this is only a small hint about what happened during the procedure. Pre-operative, as we said, very important. We will check you are fit for surgery. You're doing some investigation you are doing very important blood test to showing no have any bleeding, and also will have a ECG called heart tracing before the operation. Post-operative, some precautions very important. What explain some precautions very important to know. Every patient have ICD very important to know after post-operative. First thing about the strength activity, and this is one concern of the patient. He told you, I want to play football. Can play football? About try to avoid any strength activity as avoid around 4-6 weeks after the pacemaker, and able to do most activity and sport after this 4-6 weeks. يعني in the first when the patient have this ICD, first we can feel heavy at first. It can become something abnormal, uncomfortable in the first days. There's no problem. However, we regular checkup. Regular checkup. If you not feel it's okay, can regular checkup and make sure your speaker more work properly. Most pacemaker store information about the natural heart rhythm, can retrieve the information, so it's record all what happened during this ICD after operation. It's very important in UK to wear medic alert bracelet. It's very important to inform the patient that because anytime the patient has a heart attack and has admitted to any hospital, any doctor will deal with him, you must know the patient has ICD. It's very important. So is wear medic alert bracelet in UK. It's very important. Or maybe necklace have advice. It's very important because the patient to avoid to doing an MRI or give any medication wrong to this procedure. So it's very important to inform the doctor or to inform the patient you have medic alert bracelet or the necklace. Some question about safe to have bath or shower after 4 weeks after the operation. Keep the arm in same days as below the shoulder in the يعني after the procedures. Do gentle arm and shoulder exercise. All this I think this general information. It's okay. You don't need to know all this, but I give you some ideas because don't remember in the exam you can choose any one of this information. But I think it's very important. This is very important to inform patient to wear medic alert bracelet. Can I ask you, will be any pain after procedures? Some pain or discomfort during first 48 hours. This is normal. So after having ICD fitted, you have been given pain relieving medication. Ask you after procedure, I feel pain. It's a normal pain after the procedure. يعني very important to inform the patient, as I told you, very important to inform what's the complication we had. As I told you, we're doing by expert doctor. However, as any procedures must have any complication as infection, maybe bleeding, hematomas, leads, maybe dislodge or migrates, cardiac perforation, pleural effusion, pneumothorax, and device dysfunction, malfunction of generator is normal. يعني form infection, bleeding, trauma, ممكن cardiac perforation, any air inside the pleura or the lung is normal. Communication with any procedure, but must to inform the patient what's the complication. Some precautions very very important in the ICT. You have, as I told you, not know all this, but I'll not try to take 5 of some precautions to remember in the exam to inform the patient what precautions or lifestyle change to avoid any harm to ICD. طبعا it's very important keep your ICD card with you all time. Very important, as I told you, maybe bracelet or necklace or card. And card is this in UK is ICD card, called ICD card, to have keep with patient to know all the time you have ICD. It's very important MRI. Very, very important. Avoid magnetic MRI machine. Very important because this affect the programming and function of pacemaker. تمام. So very important, can cause heating of pacemaker. It is very, very important. يعني to avoid any MR machine is very important advice to the patient. Sexual activity can ask you about what sexual activity because this have exercise or exercise maybe this give electrical shock for not causing harm even if shock is delivered during the course. Very important because yeah, if doctor I having sexual activity with my wife maybe has electric shock, yes, but that's not harm, no problem. يعني after time we'll deal with it. Electrical equipment very important about the any electrical equipment as radio cookers, microwaves is will affect my ICD. No, يعني all this question can ask in from patient. From patient you can ask you, doctor, what about the electrical advice, radios, cookers, computer, microwaves not affect the ICD. Travel is very important about the travel. Why? Because airport security alarm is very important because he have to inform the policeman I have ICD. So when you pass security alarm maybe give set يعني maybe give sound, so it may set off the airport security alarm. Tell airport security about the pacemaker. Very very important. Mobile phone, try to not keep the mobile phone near your ICD, about 6 inch about for ICD, and hold the phone over the ear or opposite side to device. Try to keep the earphone and the opposite side of the ICD. It's very important if you have surgical procedures, you have to inform the dentist and of surgery was because we have maybe informed about to take precautions about the infection and maybe temporary turn off or set special mode. Very important. I think this any advice you have to know because inform any patient have ICD. I think it's very important about his job and his driver. If the driver you have informed, if you don't know what's the instruction from the DVLA, only is diplomatic answer. We need to have informed DVLA about your condition. You will assist you how long you banned from driving for. يعني not do not inform something to patient don't know or not sure about it. It's very important not say wrong information to patient. If you don't know, you can say I will we can inform DVLA and will assist you and will inform you what for how long you are banned for drive. However, if the patient is group 2 is bus driver or lorry, I think is permanent banned. It's okay. But if you don't know this point, not inform the patient any wrong information. You inform him I will discuss issue with my consultant or I will refer you to the DVLA and will assess you and will inform you about any information. I think it's very a very interesting case and very scenario. I think it's a new scenario, not common but came up before. I think it's very important to know about ICD. What's the ICD before the procedures and during and after, and what's the precautions? Very important about the medical alerts or necklace, about the MRI, about sexual activity, about stress activity, and I think about any harm from any electricity equipment. I think this is very important and driver very very important. I hope to finish this scenario. I think it's very interesting scenario. So anyone has any question we can answer before close the record. Anyone have any information wanted to give information or any comment? It's okay. Anything? Anyone to ask? It's okay. It's okay. خلاص we can stop record.